Mayo Clinic is completely committed to the needs of the patient and to the needs of our staff. And tobacco kills, and secondhand smoke is very dangerous. And so Mayo Clinic truly believes that, has believed for over 25 years, that we need to be smoke-free and now tobacco-free. It's better for the patients, it's better for our staff. And so what we did at the Clinton Global Initiative was come forward with a second commitment on the heels of last year's commitment, and we're asking the private sector, non-government organizations, as well as governments to join us in a challenge and to bring a smoke-free environment to their workplaces. Well, we've had tremendous success with the Global Bridges program across the world in tobacco control and tobacco treatment. And the buy-in to that has been truly inspiring. There's lots more work to do, but we're off to a very good start under the leadership of the team. So that's a big story. Bringing a smoke-free worksite to those areas that I mentioned, the private employers and governments and non-government organizations, is huge because nicotine dependence is a major health problem, and the folks that are nicotine dependent need a lot of help to break that cycle of nicotine use. And we all know that. And they need our help as healthcare professionals, but they also need to be in an environment where they're supported by their by their employer and by their employee group, that the goal is clean air. And what we've found, or what's been found in smoke-free workplace initiatives, is that tobacco use goes down. People are more readily able to stop smoking. Secondhand smoke, of course, disappears. Air pollution basically gets dramatically improved, and kids are less likely to start smoking. Healthcare costs go down for the organization, the employees are healthier, and productivity goes up. So for all those reasons, it's a very good thing to aim to do, but nicotine dependence is a big deal, and getting people from dependence to no longer dependent is a long-term process that requires a lot of help. And we're asking the employers to help people who are nicotine dependent to reach that goal. Well, it's an interesting story, really. If one goes back to about 27 years ago or so, the board chair of the Board of Trustees literally said to the Board of Trustees, "It's time Mayo Clinic became smoke-free." And at that time, it wasn't uncommon for our physician leaders, if they were smokers, to smoke at meetings and at dinners and that sort of thing. That was just the way the world was. And the light went on and said, it's time. So what Mayo did at that point was they said, we need to become smoke-free for all the reasons I had mentioned. And they put together a task force comprised of smokers and non-smokers across the spectrum of Mayo Clinic leadership and employees. And they came together and said, what are our policies that we need to change to become smoke-free? And rapidly, over a period of a year or two, Mayo Clinic declared that it would be smoke-free. And we were one of the first large employers in the country to do that. And the benefits have been huge. As you know, recently, we've seen that positive effect spread beyond Mayo Clinic to the county, then to the state of Minnesota. So Mayo Clinic is not trying to do this alone. We're part of a coalition of leading companies from the private sector, government departments, if you will, as well as non-government organizations to come forward with this challenge. We are the healthcare provider organization that's doing that, and to give credit where it's due, our leadership within Mayo Clinic, Richard Hurt and his team, have been major players in moving that forward. I think the fact that Mayo Clinic is so obviously at the front of this vanguard with the Global Bridges last year and now with the Global Smoke-free Worksite challenge, if you will, brings a lot of attention to the importance of this problem, because our name is a name that's recognized globally, and it's a trusted name. And if Mayo says we need a smoke-free environment, people will pay attention to that. Mayo Clinic's doing this because we realize that tobacco kills, And secondhand smoke is very dangerous. Just for to remind ourselves, about 6 million people die every year from smoking-related and tobacco-related illnesses. 10% of those, 600,000 people, have never been smokers themselves. It's secondhand smoke. Secondhand smoke contains the same 700 chemicals and roughly 70 carcinogens, chemicals that cause cancer, as does active smoking. And there's no filter. There's no system that can clean the air from smoke. So if you've been around a smoker, it takes literally minutes to change the biology of the coronary arteries from inhaling secondhand smoke. So this is a lethal problem for employees who don't choose to smoke. They have a right to clean air, and yet they're passively inhaling this with the toxins, and their bodies are changing minute by minute because they're inhaling secondhand smoke. Now think about it. We cleaned up asbestos a number of years ago. We would never expect our staff, and no employer should expect their staff to be exposed to asbestos. We know that causes the mesothelioma cancer, which is a lethal cancer. Secondhand smoke is much more pervasive, and so there are literally tens of millions of people around the world exposed to this, and they don't need to be. You can say, well, I have a right to smoke. Well, wait a minute. We all, as citizens, have a right to clean air. That trumps the individual right, in my opinion, in our opinion, and in the opinion of the Clinton Global Initiative.